Hello everyone and welcome to Mountain Lake Journal. I'm Tom Howard. New York Governor Kathy Hochul has announced some major funding, $20 million in startup money for school-based mental health clinics to help combat the state's youth mental health crisis.
And that's what's so extraordinary about this school district, and I really want to replicate this all over. The fact that you have an in-house support system.
The governor met recently with students at Mohonasen High School in Rotterdam, a school that invested in its school clinic and mental health services for students even before the pandemic hit.
I want to thank them for being so candid and really talking about the challenges that they've faced really since the pandemic. And what I take note of is that many adults don't talk about the pandemic anymore. I mean, it's in the rearview mirror. People have moved on. But what is underneath the surface is that young people who are seniors today, who are freshmen when the pandemic started, they're still dealing with the effects of that disconnection from their support system, from their friends and the classroom and the activities and the sports. And it really has had a long-term effect on many young people. And they'll talk about it. They're honest about it. And what they're also honest about is that there is a need for more young people to receive mental health services and care, even at a younger age. You know, we're talking now middle school, high school. We just had a conversation about how our elementary schools, a lot of young people are still struggling at that level as well. And I've long believed that every ounce of energy we put into and the resource we put into helping young people deal with these challenges now, whether it's depression or sadness or whatever they're dealing with now, if we can solve it now and help them have the coping skills now, they'll lead a better life later, a healthier life. So that's why talking about our schools is so important to me.
The governor also heard from students who talked about the significant impact that social media can have on their mental health.
It's something they were very candid about, talking about how, many of their friends, if they feel that there's an addiction, a pull because of the algorithms, and one of our enlightened students here even point out that there's a profit motive to keep from the companies to keep you hooked on this. And they recognize it, but a lot of other young people don't realize that they're being pulled into this for reasons that are not for their own best interest. And when you think about the mental health crisis, the Center for Disease Control tracks this. And they have said that 1 in 4 teenagers have actually considered suicide. That is double what it was just 10 short years ago. And 1 in 3 young girls, high school girls in particular, have entertained the thought of suicide.
The governor said state lawmakers are looking at bills that would reel in social media. She says the mental health crisis is one of the biggest challenges the state is facing, and that this startup funding will help give kids, parents, and teachers some of the critical tools they need. She said the program at Mohonasen has helped hundreds of students with in-school mental health counseling and services.
And I could say that this is a healthier school environment than many others that have not embraced the opportunity to provide these services right on site for our young people. Think about a young person who finally recognizes, I need some help, or their parents see it, or a peer sees it. And yet they have to now ask their parents to take time off work, to make an appointment, pull them out of school. They need to go every week for a long time. It just doesn't work. But if you provide those services right here in a nurturing school setting with professionals and adults who care about them, and teachers who are trained to see the signs, and students who are trained to see the signs, that's how you build an ecosystem of healthy young people. And I want more schools to do this.